I'm going to be your nurse today. Can I get your name and your birth date, please?
John Phillips, 4/14/49.
Awesome. Thank you.
I think you just said.
Or not their vitals, their name. I'm gonna write my name on this board just in case you need to get in touch with me for the rest of the day. You know who to ask for. So today I'm gonna be taking your vitals. I'm gonna check your respiratory rate, your oxygen saturation, your heart rate, your blood pressure, and your temperature. I'm gonna do that.
I'm gonna need you to tell me.
Afterwards, I'm gonna make sure the room is safe. So I'm gonna put the bed rails up. I'm gonna lower the bed just in case they need to get up and go to the restroom.
And then I'm gonna take your vital signs. So I'm gonna take your temperature.
Give them the
your
call
heart
light
rate, your respiratory
and the red
rate,
buttons for
your
me,
blood
and everything
pressure,
else is for their TV.
and your oxygen saturation.
Get their bedside table right up next to them.
We're gonna put your bed rails up.
And I'm gonna set their bed alarm if they are a fall risk. John, do you need anything else from me while I'm here?
No, I'm okay. Thank you.
Thank you. Okay. In order to take the temperature, I would take the probe out, place the covering on it, make sure it's on the right setting for oral, put it in the posterior sublingual pocket, and it's gonna start loading. And she's at 98.8, which is a really good temperature. Discard the covering and place it back in. All right, in order to take vital signs, you're gonna have to take the blood pressure cup and put it between 1 to 2 fingers above the patient's brachial artery. You wanna be able to fit 2 fingers underneath so it can move. Then we're gonna be looking at the pressure gauge and using the pressure bowl to pump it up. I found our artery and I started out and I got 100, so I added 30 to that. So I'm gonna start and pump it up to 130 in order to get the blood pressure. And I got 100 over 67. So her blood pressure with systolic being 100 and diastolic being 67. Next I'm going to do the pulse oximeter and I'm going to place it on her index finger. She does not have any nail polish on, so it's not going to show any errors. I press the button and then I place it on there and I let it load. It's going to tell me her oxygen saturation and then it's going to tell me her heart rate. And it says that she has a 99% oxygen saturation level and that her heart rate is 76. Okay, the last 2 vital signs I'm going to take are the heart rate and the respiratory rate. I'm going to set a timer for a minute and spend 30 seconds on each and multiply both by 2. Okay, so her heart rate is going to be 74 and her respiratory rate is 16. Between each patient and each procedure, when taking your vitals, you need to practice hand hygiene. You need to put some on before you enter the room. After you leave the room, you need to make sure that you clean your equipment with alcohol wipes, and especially on your stethoscope and your blood pressure cuff and the inside of your pulse oximeter.